As a general broad description of metabolic syndrome, it's a compilation of various indices that when they're elevated or off, increases your risk of heart disease, increases your risk of diabetes. It's your genetics plus your lifestyle times time, i.e. over time, will lead to whatever you're feeling right now.
All right, welcome back, everybody. This is Ryan Diener with Holistic Health Associates, and we are here for our collaborating with high-quality healthcare professionals in the area. And I am so excited to be here with Dr. Kelechi from Olney, Maryland. So if you, before you even get started, make sure you like this video, make sure you share it, comment on it. We're going to be talking a lot about metabolic syndrome and some of the different things that relate to your gut today. So so make sure you like it. So Dr. Kelechi, welcome. Thank you for being here. I'm so excited to chat with you. Dr. Kelechi is in Olney, Maryland. She has an incredible history that I'm going to let her tell you about in just a minute, but she's been a high-level doctor, and she's now doing functional medicine. You can reach her online. She has an online platform. She does house calls. You get more accessibility to her than any other doctor I have ever spoken to. So, so Dr. Kelechi, tell us a little bit about kind of how you got to where you are, your history, and how you became a doctor, and then the type of medicine that you're practicing. And then we're going to talk about metabolic syndrome after you do a couple minutes on that.
Okay, absolutely. So, well, thank you so much for having me. I so enjoyed our visit last weekend. It was just like, I felt I was having a kumbaya moment, and we just really connected at so many levels, not just, with medicine and healthcare, but just life in general. So thank you for inviting me to be part of your show and to, be here with you. It's really an honor. So Dr. Kelechi, well, just as a brief introduction, I'm a double board certified family medicine and preventive medicine physician. I'm also a mindset coach. I'm also a global speaker and an international best-selling author. Just had a book launch last year. But through my concierge medicine, functional medicine practice, I help women truly achieve a holistic approach to their health and wellness. I help them get to the root cause of their chronic conditions so they can truly get off prescription drugs and use food as medicine. And I help them in the process manage their weight and metabolic syndrome. And I do all that with one-on-one coaching, with group coaching, with telehealth, as well as home visits. And I love it. So as I mentioned, I've been practicing medicine now for nearly 20 years, 19 years exactly, right? And in the primary care and world, right? So I've been through the whole spectrum as a family medicine doc. I've done academic family medicine, which is where I started. I love to teach. I've trained medical students and, physicians in training. I've worked at healthcare for the homeless. So I've taken care of folks who are at the very bottom in their lives to the very, very wealthy. I've worked in state health departments and community health centers. And I've done the HMOs and the community medicine clinics. And what I realized, I've even delivered babies, nearly 500 plus babies in my career as a family medicine doctor, because where I trained at Georgetown, it was very focused. It was heavily focused on not just community medicine, but also obstetrics. So I truly came out of my training very well prepared for the world of primary care. But I wasn't prepared for the world of dysfunction, okay? And I felt like, and did I mention urgent care too? Yes, I've done urgent care as well. I felt like, everything was so disease focused, and that is truly the nature of our current healthcare delivery model. It is very disease focused. And I know that I, as an individual, I truly came into medicine very altruistic. And I really thought I was going to heal people. I really thought I was going to cure things. And I found out after nearly, 2 decades that I wasn't really healing. And that was my true calling to what I was supposed to do, was to heal people. And so I really discovered functional medicine about 2 years ago. And I realized that, oh my goodness, this is what I've been looking for my entire career. And it was here all the time and I didn't know about it. They don't teach us this in traditional medical school. I remember medical school and I had a phenomenal education at Rutgers. It was a great training, but I think I had like maybe 2 to 3 hours of nutrition in my entire medical education, not even like a half a day. So I mean, what do you expect? When now I know that food is medicine. Medicine is not medicine, right? Now, what I practice now as a functional medicine doc is I get to really use the best of what we have to help people heal from within. So it's all about going back and really trying to heal from within. So that's what I love about what I do now.
Fantastic. And it's the reason I think that one of the reasons that we connect so well is that besides just the fact that you're a fantastic human being, is that your focus on the underlying component of why somebody is experiencing what they're experiencing, as opposed to just throwing some water on the fire, is exactly the same philosophy that is underlying the holistic medicine model, which is to not just to make the symptom go away, but to really get at why the body created that symptom in the first place. And how do we go back and retrain the way that the body is functioning, the way that the relationship between the digestive system and the respiratory system, the relationship between the circulatory system and the nervous system. What are the things that from a holistic point of view are just a little bit different and a little more comprehensive or like kind of communication oriented versus the allopathic model, which is very much about fixing the problem that is there, regardless of what other problems it may or may not create. And we work with doctors all the time. There's no problem with it, as we've said in many of these other videos. I mean, it's totally necessary. It's just, there are other options, and there are so many people that would benefit from getting more to the root of the problem and not having recurring issues, as opposed to just dealing, covering the symptom and then it recurring 3 or 6 months later.
Yeah, I mean, my goodness, friend, there's so much that is different. I mean, it's almost like night and day, unfortunately. What I had been doing, and I put myself in that place, is because that's what I was trained to do, was to look at the downstream effects, right? Like you said, put out the fire, but where did the flame come from? What triggered the flame, right? So when you look at the downstream effects, you never heal. So I was getting so frustrated because really 15 years later, you still have diabetes? That just does not seem right anymore. It just was not right anymore. It was just not okay anymore. That I'm still prescribing you the same pills I was prescribing you, a different type, a different class, right? But we're still dealing with the same problem. And that is why our healthcare system is getting so expensive, is because it's just not sustainable, right?
So what can you do as a functional medicine doctor, just for those people that don't realize the difference, and why you can actually talk about this from getting to the root versus what you were doing as a primary care physician? Now that you've done both, really, in a short snippet, why is it different? What can you give them that you couldn't give them as a primary care physician?
I can give them the benefit of time. Like a 7-minute visit, I cannot get to the root cause of your problem. Number one, it's customized to you. It's not a one size fits all. Nicelapine does not work for everybody. A statin does not work for everybody, right? So what I can give them as a functional medicine doctor is the benefit of time to truly understand their lifestyle. There's one very simple equation. It's your genetics plus your lifestyle times time, i.e. over time, will lead to whatever you're feeling right now. However you feel right now, if you're tired, if you're fatigued, if you're moody, if you're depressed, if you have high blood pressure, if you have diabetes, all that is just the downstream result of genetics plus lifestyle over time. So there's two things I cannot fix. I can't change time. I wish I could, but I can't, right? I can't change your genetics, but there's so much we can do with your lifestyle. And that is what we don't do very well in the allopathic world. Gotcha. Is really sit down. I can't even get paid for that. Mm-hmm. So I'm not even incentivized to prevent disease. Mm-hmm. So if the model is set up where I'm not even incentivized to even talk about it or address it in a meaningful way, how on earth am I going to change the outcomes that you experience over time? 5, 10, 15, or maybe 18 years later, where I am now. I cannot. So that's the difference, is I get to really work and look at the whole picture. That we just it's not the fault of any particular doctor. It's just the way the system has been set up. Yeah. It's not meant to prevent or heal. It's just meant to sustain what is.
Yeah, and I would even add that as you have trained to be on the functional medicine side, you haven't just jumped from primary care to functional medicine in concept. You did a number of trainings to learn and educate yourself on how to not only make those lifestyle recommendations, but how to support with different supplementation and different lab testing that goes beyond the typical kind of blood lipid panel that you get as a primary care physician. And when you do that, the value that you bring to the patient is that you have more tools in your toolbox, number one, but you have a deeper expertise in the ability to guide them into things that they can do for themselves. Right. that can take the place of medication, surgery, hope, you know what I mean? Like those kinds of things. So.
Yeah, no, absolutely. There's so much more tools in my armamentarium now because I know what I've been doing and I know what I can do, what added value I can bring to the table, right? Because just getting a basic lipid panel is not the whole story, right? Just looking at blood pressure is not the whole story. Okay, I can do, blood testing based on your genetics to tell you exactly how much exercise you need. It's not just get 3 times a week or 5 times a week and you're good. And I'm not even telling you what kind that you need, but I can be so specific. I can actually give you an exercise prescription that is so specific to you, your body, your DNA. It's not a one size fits all. That's what I keep emphasizing. It's really about I don't really care what disease you have. I want to know who you are. Because when I know who you are, then we can start talking about what's your trigger, what are your triggers, right? And then when I know what your triggers, I can start figuring out how to remove them. But if I don't even know what your triggers are, because I don't know who you really are inside, I can't even begin to help. But with functional medicine, I can identify your triggers. And that's so powerful.
Beautiful.
And then I can, besides removing them, I can now replace what's missing. A lot of the times in medicine, we don't really, the depth of the investigation is not really very deep sometimes. Sometimes it is, sometimes it's not. But the depth of the investigation I can do with the functional medicine tools really show me what your deficiencies are that you may not even know about, and it's not even your fault because you just didn't know because nobody had ever looked before. So now that I know what your deficiencies are, guess what? I can replace them. Mm-hmm. And if I can replace them, then you're going to feel better, right? And it could be just with micro or macronutrients, depends, right? So there's so much that we can do. Just the first 3 months there's so much we can do right away for people to start to feel better because we start to identify what it is that is triggering them. And then we start to figure out what it is that they're missing that we can actually give them back to start to heal from the inside.
Yeah, fantastic. And so I think that we could probably spend 3 to 5 hours talking just about sick care versus healthcare. And it would be a fantastic,
at least 3 days.
Yeah. And it would be a fantastic conversation, but I want to get into specifically one of the conditions that you treat a lot and that we treat a lot in our office, which is metabolic syndrome. And metabolic syndrome, for those people that hear that and go like, well, what the heck does that mean? Can you define that, because metabolic syndrome is different than just quote unquote weight loss. And it's different than diabetes, and it's different than just a hormone imbalance. It's kind of a term that incorporates a lot of different things. So
Yes.
we hear your definition of metabolic syndrome.
Well, the definition is really, you start with there appears to be a dysfunction in the systemic function of the body in multiple organ areas, right? So we look at just starting from outside to within, right? So we look at your waist. So there's certain parameters we'll look at. There's the waist circumference, right? We measure those things. Sometimes it's not even measured. It's just assumed that you have a certain BMI, then it must be elevated, right? We'll look at your blood pressure, right? We'll look at your blood pressure 135/85. If it's higher than that, then that's a problem. We'll look at your blood pressure, right? We look at your blood glucose. Your blood glucose fasting greater than 100 is not good, right? We'll look at your HDL. And there's so many other things that we look at. And I think, and one more is the triglyceride level. Yes, triglyceride is very important because when we do a ratio, that's also a risk factor. So we look at various risk factors to say, okay, this person, things are off, but I think it's even too late at that point. There are other elements we can look at to predict what's about to happen. And that's the beauty of functional medicine. So we can go a little deeper than that. But just as a general broad description of metabolic syndrome, it's a compilation of various indices that when they're elevated or off, increases your risk of heart disease, increases your risk of diabetes. So they're just markers that we can look at. Yeah. And the reason I love to start there is because when those things are present, it tells me there's a lot of inflammation going on, right? And it tells me that, the horse is out of the barn, right? So now I really got to dig a little deeper and go back in time and see how did we get here. And by doing that, we can now start to address each of those things through lifestyle. Because again, I stick with my equation. It's your genetics plus your lifestyle. Over time, it's going to give you whatever condition. Could it be diabetes? Could it be autoimmune disorders? Could it be heart disease? We got to look at your lifestyle. And lifestyle is so many things. It's not just how you eat. It's where you live. It's how you sleep. It's how you move. It's your genetics. It's your environment. It's the toxins, right? So those are all the different components that contribute also to metabolic syndrome.
Yeah, fantastic. And, one of the things that we notice in our office that we see a lot are people that come in for weight loss who say, I have done XYZ and nothing's working. I'm not losing weight. And so, that's kind of one of those triggers for me as a practitioner that goes, oh, this is not just about calories in, calories out. This is some sort of inflammatory process. It's some sort of dysfunction in the metabolic system that is there to keep your weight at running, keep your energy level up, doing the things that you need to do. So there's certain triggers that kind of point to this being a possibility. Besides trying to lose weight and no weight coming off, what are some of the other triggers that you see in your practice?
Well, besides trying to lose weight, first of all, I like to classify, what does that really mean? What does that mean? I've tried everything. I've tried this. I want to know exactly what you tried and how you tried it. Because a lot of the times people know what to do, but the support isn't there. Just by watching somebody and giving them the support that they need, they could be so successful, okay? So you really have to do some soul searching and some testing as well. To really find out the whole story. It's more complicated than I've tried everything and nothing's worked. Well, what is everything? What did you really try? And what support did you have in the process, right? Was it for 2 days? Was it for 2 months? Because again, we also, as human beings, we tend to be very impatient. Our culture is like, give it to me now, give it to me quick, otherwise it's not going to work. So it takes time. If you're 53 or 43 or 63, you didn't get here in 43, 53 or 63 days. It took you decades to get here. So it's a process. So I try to set a realistic expectation of, are they ready right now? Are they committed right now? So once that is set, then we go to work. Okay. So there's specific tests that we can do that look at your gut. Okay. If the gut is sick, you are going to be sick. Okay. So part of my armamentarium of how I approach really, chronic conditions is first, let's identify your triggers. Okay. What are your triggers? Is it sugar? Is it stress? Is it sleep? There's something that's triggering you not to be where you are right now. Okay. What are the deficiencies? So let's get some stool tests. Let's get some urine tests. That's going to tell me a lot about what you're missing, because what you're missing is what's blocking the pathways in the liver to help you get rid of the toxins that are sequestered in your adipose tissue that's not letting go of the weight, right? So the pathways are backed up. If that's not addressed, we're not getting anywhere. We got to address that, right? So that is the aha. I'm like, oh my God, I didn't know I needed that. I didn't know I needed this. I didn't know I was low in this. Yes, that's why the pathways are like, think of a pipe that's clogged. We need to unclog those pathways, those detox pathways, especially in the liver, so things can move, so toxins can leave the body, right? So we have to take it systemically. So what are the triggers? What are the nutrients? Now let's look at your gut. Detox is powerful. Now we got to look at your gut, because your gut is 80% of your immunity is in your gut, right? If your gut is messed up, then you're not going to be processing your macronutrients properly, let alone your micronutrients. Okay. And if your gut is impaired, then that's inflammation happens right there, right? And that triggers so much. So certain blood tests can also tell me if your inflammation is just out of control. And then we can dampen that a little bit, and that can help to start to reverse the process, right? So there's so much we can offer patients that can really get them from where they are right now to feeling better, okay? So once we address the gut, we got to address the detox pathways. We got to address the gut pathways, right? This is so intrinsic to how you function as a human being. You can't separate them, right? That's why it's not just calories in, calories out, right? Then we got to now go into rebalance. How are you moving? We got to move. We got to move to increase the insulin sensitivity to your musculoskeletal system, right? How are you sleeping? Sleep is critical to weight gain and to stress and to the stress hormones, right? So that is the whole rebalance piece. And at the end of the day, is the foods that you're eating right now, is that the right nutrition for your body? Not for everybody in the community or your whole family, but for you, is that the best nutrition? So it's really a multifaceted approach to weight management.
It's beautiful. And it's interesting because from an acupuncture point of view, people always ask us like, oh, you're treating my gut. Why are you putting a needle in my shin? And there's that point in the shin has been tested with electrical, it's where that electrical node goes causes a rebalancing of insulin of the body's uptake of insulin. And so it's fascinating. And, people are kind of just surprised that there are all these parts of the body that can affect other aspects. And we are one organism, we are one big forest. Our bodies are a big, huge forest with all kinds of things going on, and they're dependent on each other. And so you can stick a needle in one area and literally affect gut, gut markers. And you can put, take plant-based supplements, and that can be something that affects your musculoskeletal system. You're taking us up, so there's so many ways that the body and the mind are related to each other, but in areas that you just don't expect, and you don't, you don't get these options when you just go straight to the primary care office,
Yeah. And I think also because just the way the system is structured, it's very siloed, it's very specialist, the heart doctor, the lung doctor, the GI doctor, and different drugs are now interacting with each other, and we're not talking to each other, and the patient's not getting any better because the statin is affecting the Pepsid, and the Pepsid is affecting the warfarin, and the warfarin is, it's a mess. It's like you're messing up the forest, and you're messing up the ecosystem, right? So we just need to slow down and say, okay. And there's just think of just the PPIs and the havoc it wreaks on the body. Yeah. You know how hard it is for me to get my patients off PPIs.
Oh my
I
God.
literally have to wean them off.
So for those of you that
rebound.
for those of you that don't know, a PPI is a medication for acid reflux. It's a proton pump inhibitor. And so we have tons of patients that are on these things, and they make it very hard to get your body's natural relationship to its own stomach acid, to its own chemicals in the gut to regulate, because you've got this thing that's kind of like constantly dampening it down. And so, it's interesting because there are so many different pathways in to weight and why someone is having trouble losing weight. And having these kinds of lifestyle, supplementation, movement, body work, all mental work, all these things actually affect your weight loss much more than calories in, calories out. No question.
Absolutely, because you might not even be eating the right calories. Right. You might not even getting the right phytonutrients, right? You could be your palate, your plate may be so not even right for you. Okay, so that's why it's not just calories in, calories out, because what you have on what the calories you're eating may be completely wrong for you, maybe not what your pathways are needing, right? So I just love that we in this space get to really do the deep dive and the real work to truly understand who is before us, okay? And then looking at their biochemistry. It's so evidence-based. I'm looking at your biochemistry. It's telling me that this is off and that is off. And based on what is off, I know what I need to give you to catch you up so things can move. So it's not your fault. I keep saying that it's not your fault. You didn't know. And what you don't know, right? And that's why, the weight loss programs, it's a one size fits all. It cannot work for everybody. And when you stop and then it comes back, because it was not a change. It was an episodic, intervention to a chronic condition. And that's what we do. We give, acute care approaches to chronic conditions.
Yeah, fantastic. I love it. I think that, you're right on. I think, helping people to understand that this isn't, their fault, that they got here through a long stretch of cultural influences, family influences, genetics, and time. And now, you're here. So now it becomes your fault, because now we know better. Now we know, hey, we can do some things to help get over this. And it's a really valuable way to look at it, because it doesn't give you any culpability for the past. It's all about where we are now and how we're moving forward and how quickly we're going to get there. And, for those of you that are out there that are having trouble losing weight, and that do have a suspicion that it may not, that it may be something more, and there may be some other factors at play. The weight is just the first phase of this. After the weight stuff, once that's on for a while, then we run into the things that you were referring to before, the heart disease, the diabetes, and that's when it gets even harder to get your body rebalanced. And so if you suspect that your body needs a kick, as most of ours do, and recalibration, Dr. Kelechi is available. Tell people how to find you, because otherwise I'm going to just keep talking to you about this. So tell people how to find you.
You can find me drkelechimd.com. That's my website, Dr. Kelechi. That's DRKELECHIMD.com. And also on all social media platforms, Instagram, Facebook, as Dr. Kelechi MD.
Fantastic. Well, this has been amazing. And I have a dozen different topics that I want to get into with you. I know you focus on women's health, and you do so many different things, for women, and metabolic syndrome is just one of the things that we see so frequently in women. And, we want to help. And so for those of you that are watching this, give us a call, give Dr. Kelechi a call, see what we can do to kind of get you moving in the right direction. Like, share, comment, let us know what you thought of this. And that way we can keep bringing great people back and sharing them with you. So thank you again, Dr. Kelechi. This has been fantastic.
It was so much fun. Thank you, Ryan.
Yeah, take care. We'll talk to you soon, everybody.
All right. Bye-bye.